Do you sometimes feel like your chest hurts when you breathe deeply? Or maybe you've had a cough that just won't go away, and you feel tired all the time. What if I told you these could be signs that your lungs are fighting an invisible enemy? That enemy might be pneumococcal pneumonia, a type of lung infection that starts quietly but can become serious fast. Think of your lungs like a clean air filter in a car. When germs invade, it's like clogging that filter. Your body struggles to get oxygen, and you start feeling awful. Many people ignore early signs, thinking it's just a bad cold. But this isn't just a cold. It can land someone in the hospital, especially older adults or little kids. So, when was the last time you paid attention to your breathing? Okay, so what actually causes pneumococcal pneumonia? Let's break it down. Imagine tiny bacteria, so small you can't see them, called Streptococcus pneumoniae. These little bugs are like sneaky burglars. They often live quietly in your nose or throat without causing trouble. But when your body is tired, stressed, or already fighting another illness, like a cold, they sneak into your lungs and start multiplying. It's like leaving your front door open. The germs move right in. They attack the air sacs in your lungs, fill them with fluid and pus, and suddenly, breathing feels like sucking air through a wet sponge. These bacteria spread when someone coughs or sneezes, so being close to a sick person increases your risk. Have you ever caught a bug bite after sitting next to someone who is coughing on a bus? That's how easy it is to pick up these germs. So how do you know if it's just a cold or something more serious, like pneumococcal pneumonia? Let's play detective. If you have a high fever that won't go down, a cough that brings up yellow, green, or even bloody mucus, and sharp chest pain when you breathe, your lungs are sending an SOS. Other clues: feeling super weak, sweating a lot at night, or trouble catching your breath after walking upstairs. Imagine trying to run after holding your breath. That's how your body feels. Some older people might not even have a fever, but they feel confused or dizzy. Scary, right? One mom noticed her dad kept forgetting simple things during his illness, and that turned out to be a key clue. So ask yourself, have you or someone you love been feeling unusually weak with a bad cough lately? Now, if you suspect pneumococcal pneumonia, what next? Doctors don't guess, they investigate. First, they'll listen to your lungs with a stethoscope. If they hear crackling sounds like bubble wrap popping, that's a red flag. They might take a chest X-ray, a quick picture of your lungs to see if there's fluid or swelling. Blood tests or sputum samples, that's the mucus you cough up, can confirm if Streptococcus pneumoniae is the culprit. Once diagnosed, treatment usually means antibiotics, medicines that kill the bacteria. Think of antibiotics like SWAT team for germs. Most people start feeling better in a few days, but it's super important to finish all the medicine, even if you feel fine. Otherwise, the germs might come back stronger. In serious cases, hospital care with oxygen or IV fluids might be needed. Have you ever stopped taking medicine early because you felt better? That could be risky. Let's not do that. Good news, we can fight back before the bacteria even attack. The best shield: vaccines. There are vaccines, like PCV13 and PPSV23, that train your immune system to recognize and destroy Streptococcus pneumoniae before it causes harm. It's like teaching your body's security team what the burglar looks like. Doctors recommend these vaccines for kids under 5, adults over 65, and anyone with weak immunity. Besides vaccines, washing hands, covering your cough, and staying away from sick people help too. Think of it like locking your doors and windows. One school started teaching kids to sneeze into their elbows, and cold cases dropped. So, are you up to date on your vaccines? It's a simple step that could save your life. Science never stops. Recently, researchers are working on newer, broader vaccines that protect against more types of pneumococcal bacteria. One exciting study uses mRNA technology, the same kind used in some COVID-19 vaccines, to create a pneumonia vaccine that could be faster to produce and more effective. Also, scientists are studying how the bacteria evolve to escape vaccines so they can stay one step ahead. In hospitals, smart machines now help doctors read X-rays faster and catch pneumonia earlier. Imagine an app that warns you early that might be coming soon. So wouldn't it be amazing if one shot could protect millions more people, especially in poor areas? The future is looking brighter and smarter.